Well, I'm really interested in both the side of healthcare policy that is, what do you think can be done in the short term, but also let's say that next year you in office, but also a whole bunch more Democrats are swept into office, and Democrats have an opportunity to actually craft policy that isn't just messaging bills. What is your view on the kind of healthcare system that we should build? Because I think we need to really consider the fact that by the time we even get to that election, our healthcare system is not going to look the way it does now.
Yeah, that's right.
Because the Republican Congress had just passed a massive bill to absolutely gut Medicaid, absolutely gut the exchanges like the connector, the subsidies that people who don't qualify for Mass Health, which is Massachusetts' Medicaid program, and in case anybody thinks that that you're not on Medicaid, or that we don't have Medicaid here in this state, that's called Mass Health. If you're on Mass Health, you're on Medicaid. I am not shy about saying I am on Mass Health. I am on Medicaid.
Yeah.
My family of four, is currently receiving Medicaid benefits that we may not have next month, right? And with all the money that has been stolen from those programs in order to give rich people tax cuts, we are at risk of losing even more hospitals than we have already lost thanks to Steward, right? We are looking at a medical system in danger of outright collapse. And so that being the case, on the tiny little silver lining side, right, there may be more opportunity than in the past to say, well, what should our healthcare system, what should it look like? Not what does it look like, how can we improve this weird kludgy thing that still kind of works, but if that weird kludgy thing is gone or in such a state of disrepair that you may as well replace it, what would your prescription be?
Yeah, good. No pun intended. And your question stole a bunch of my talking points.
Okay.
But that's okay.
No, that's good. I want to hear that.
Because you got to start with what the Republicans are doing, right? They're actually taking the medical funding away from our local community hospitals through Medicaid and just transferring it to the wealthiest Americans in the form of a tax break, right? That's going to persist for decades now, and it is a really serious challenge. It's a really serious challenge for this region. I mean, we didn't even talk about the funding for the research universities and the entire healthcare economy that exists around Boston that props up a lot of employment in this area. That's a separate challenge, but it's another huge piece of this. So I guess I think about it in the same way. There's so much we could do to improve the system we have now. I've always been interested in the public option expanding to pick up more people, so you have some bedrock fallback plan that would supplement Mass Health or replace Mass Health, or to compete with private plans.
Or would allow people to buy into Mass Health,
exactly,
even if they wouldn't have qualified for Medicaid.
Right, exactly. Yeah, so subsidized at a higher income level. I think that's all important. And then look, I do think we need universal, affordable healthcare in some form in this country, right? We're the only developed country that doesn't have that. Whether that looks like Medicare for all, whether that looks like the public option coming to be a larger and larger piece of the healthcare picture, I'm kind of open to it, right? But I think you're thinking about it the right way. We are going to come into having this new space where people are going to be pissed off about the constant medical funding that have permeated their community and the weakness of the insurance plans and the lack of providers in their community, like we've experienced on the South Shore. And I think we'll be open to some exciting ideas. And my prescription is I don't want to drop something in on everyone, but those are my values, right? And those are the range of options that I think we need to consider.
Yeah, I've been wondering that because there was with the recent hospital closures, there have been people calling for hey, why doesn't the state take over the administration of these hospitals?
Right.
Because they're right there, right? Yeah. And you don't have to let them close, right? And that would look maybe less like the single-payer Medicare for all type model that people more frequently talk about than it would like sort of the NHS
or the VA,
socialized, the VA,
Yeah.
or one of these other that like directly, where the government is paying your doctor to take care of you, and there's no middleman, right? We talk about the middleman, right? If your doctor is a state employee, then no middleman involved, right?
Yeah.
It's one of these things that just every time I see something get worse, every time I see something get defunded, I ask myself, but did it have to be paid for inefficiently, or could, if we were to bring it back, do we have to try to turn back the clock, or could we make something better in its place?
And just to add one more point to that.
Sure.
The Affordable Care Act, right? 2009, 2010. We got that done. Democrats got that done. A historic expansion of subsidizing the exchange and protecting people with pre-existing conditions, and like really bringing down, actually in the long term, bringing down healthcare costs while providing healthcare to more people. So we've made important progress. We've made steps. We've improved on that, and we've protected it from these Republicans so far. I just gotta say, Congressman Lynch didn't vote for the Affordable Care Act, right? Like, we don't have a leader in place right now who is thinking about these issues the right way, that has demonstrated a track record of serious leadership on like maybe the most important domestic issue we have. And that to me is a real abandonment of the purposes of this party, and like a real abandonment of leadership on an issue I think is so important. And that's part of why I'm doing this.
Right. My recollection is that Congressman Lynch did vote for at least some of the Affordable Care Act votes, because there were a lot of them. There was a vote for the House bill, then there was the vote for a reconciliation package, and so on and so forth. And I think he voted for at least one or two of those, but I distinctly remember sort of this gamesmanship around, will I or won't I vote for this thing, when it was we knew that the margins were very slim. There was a very good chance that this guy Bart something or other from I want to say Nebraska, was Bart Simpson. No, that's not it.
That'd be
funny. But no. There was a congressman. He was rallying a handful of representatives to potentially vote against the Affordable Care Act, and here all of a sudden, out of nowhere, Congressman Lynch is saying, "Well, I don't know if I'm going to vote for it."
It's just not the leadership we need.
Yeah.
I find it very disappointing. I think he's changed his mind. He seems to have changed his mind on it, but
Yeah, I mean, it's funny because the proponents of the Affordable Care Act were promising the whole time, look, even if it's not totally popular now because people don't know what's in it, once it actually happens and people get used to it, they're going to like it. And you know what?
Lo and behold.
They were right. Lo and behold. And yet they're still trying to snatch as much of it away from us as possible. And it doesn't matter whether it's popular if you have the votes to destroy it. And that's kind of what we're learning this year, is that if you have the Supreme Court on your side, it doesn't matter if the law says something.
There will be consequences. There will be political consequences.
As there should be.
They will incur those.
Yeah.
The bill is coming.
So, okay. Excellent.